is no secret that diabetes is a costly epidemic. Some estimates show that 26 million Americans have diabetes and another 80 million have prediabetes. So how can doctors help battle this epidemic? Eminent researchers and public health experts, including the Surgeon General of the United States, spoke at a day-long event held by the journal Health Affairs. On the policy side, the Affordable Care Act has the statutory language to build national prevention, screening, and treatment models for chronic diseases like diabetes. One of the solutions is creation of health teams.
This is particularly advantageous for smaller physician practices. A primary care practice of 5, 6, 7 people. These teams of nurses, nurse practitioners, social, mental health workers would work with these smaller practices to help manage the patients once they leave the physician's office. So whatever care plan that patient has, they'd make sure that the medications were filled. They'd make sure that they understood what the plan was. If they were hospitalized, they'd work with the physician to make sure that the discharge planning was done and that the patient was fine at home.
On the clinical side, physicians should pay close attention to patients' glucose numbers.
The most important thing really is the evidence has improved substantially that if you intervened at the level of prediabetes, you can postpone diabetes and potentially its complications. You can definitely have impact on cardiovascular diseases. So it's time that we started paying a great deal of attention to people with prediabetes.
And on the practice side?
When you're organizing your practice care teams, make sure that you have in your teams people that are trained to deliver lifestyle interventions. The biggest failure in terms of delivery of interventions for people with diabetes is not that we don't have interventions, it's that these interventions are not uniformly implemented. And a major barrier to that is the lack of coordination. So it's a matter of how do you create a practice team where the physicians and the practice nurses look after one kind of activity, whereas the coordination of the activity is done by care teams and lifestyle intervention is delivered by lifestyle interventionists. So thinking beyond just individual clinician interfaces.
Meanwhile, just a few minutes with patients can bring these ideas and recommendations into reality. Here is the nation's top doctor, Surgeon General Regina Benjamin.
In our offices, we can translate that into practice, and that's what we really have to do. That's why the emphasis is really on us, to encourage our patients to take control of their own health and to do the things that prevent them from getting diabetes in the first place.
This is Nasim Miller.